We've been discussing how mental health is viewed and treated within the Asian community, but now we're going to shift gears and focus on another demographic that suffers from mental illness: prison inmates. To walk us through the details of the proposed mental health court, we're now joined by Councilmember SIDNEY KATZ and Senior Assistant State's Attorney Sherry Koch. Thanks so much for being here, both of you.
Thank you for inviting us.
SIDNEY, why don't you first tell us, what is mental health court?
Well, and of course Sherry would know a little bit more about that than I would, but it's both a district court and a circuit court. Has what they call mental health courts associated with each of those bodies. Montgomery County is coming as the fifth and sixth group that will be actually having both a district and a circuit court in Montgomery County. There's one already, both district and circuit in the city of Baltimore, and most of the other areas, both Prince George's County and Hartford County, each have district courts. So they deal with people who, what they consider in many cases, the nuisance crimes, and there again, Sherry would give much more of a background on that, but people whose mental health has caused them to be in the system, whereas they're not getting as much help as they necessarily could be because they're not working with the mental health side as quickly as we would hope.
So Sherry, if you can clarify for us, now these people who would show up in mental health court, they are already convicted of a crime?
So some of them are already convicted of a crime, most of them are, and they are generally low-level crimes. So for example, a trespassing or a disorderly or a simple theft crime. And that is how they get into the system. And then once they are convicted and in the system, we begin treating them, usually as a condition of probation.
Okay. Well, there's no question that the number of inmates who are suffering from mental illness have gone up. In fact, we have a statistic here. Since 2011, the number of people booked into the county's central processing unit who needed mental health care more than doubled. So do we know whether or not this mental illness is showing up as a result of incarceration or even before incarceration?
So first of all, I think we need to be clear that the overwhelming majority of people with mental illness do not commit crimes. But what we do see is that there are individuals who suffer from mental illness who commit these low-level crimes, and instead of getting treatment, the jails are being sort of used as warehouses. And that's what we're trying to avoid. So the jails are not causing the mental illnesses, it's that the mental illness is causing these individuals to commit these low-level crimes. They're then presenting in the jails, and we're looking for an alternative other than the jails to treat the mental illness. In turn, these individuals, their lives will get back on track, and then recidivism will go down.
And SIDNEY, why do you think there is a need for mental court in Montgomery County? Give us a snapshot of the prisons. Are they overflowing, and the inmates who need more than just jail time?
Well, first of all, I'm the lead for I'm on the Public Safety Committee, and I'm the lead for behavior health as it involves the justice system. And I really do not have a background in behavior health. But I certainly realized very, very quickly, and I've lived in the community my whole life, that this is a tremendous concern for all of Montgomery County. The people who are being incarcerated, the numbers of people being incarcerated have actually diminished in some cases, but the people who are in there with the mental health issues has gotten to be a higher number. So we knew that we needed to do something very differently. And that's why we had a task force of 26 people. Sherry was on it, and the state's attorney, John McCarthy. Phil Andrews, who actually was a former county council member, held the seat for the District 3 before I became the District 3 county council member. He was one of the chairs, as was Judge Gary Baer, and the Judge John DeBelius from the Circuit Court, Judge Wolf from the District Court. They were all on this committee. We had people from every background, and we realized that this is something that we need to be considering. And as I say, we had judges from the other mental health courts around the state come and talk to us. and they have proven successes. They have proven successes with it. It's something that Montgomery County needs to do, and therefore the funding had to be once we got from yes, we should be doing this, we had to be concerned about how are we paying for this. It's about right now. It's close to $300,000. The state, the court systems themselves are giving about $100,000 towards it. Montgomery County would be paying the rest, most of which goes for the case managers and everyone else involved. But it's something that needs to be done. When someone is incarcerated, it just doesn't affect that person. It affects their families and everyone who's associated with them. And if we can find a better way and to find a better help for those people, for those individuals, then we need to be doing it.
You mentioned the budget, SIDNEY. What is the goal end date? When can we expect mental health court to begin?
Well, hopefully, I doubt if it'll be in the calendar year of 2016. It would be the money has been allocated, so it more than likely would be the beginning. And Jerry probably knows much more about that than I do, but it would probably be the beginning of the actual calendar year of 2017. It's the fiscal year that we're in, but the calendar year for that to begin. And of course, once it begins, we're going to have to figure out what is working, what's not working, and make certain that things that aren't working change. And the things that are working, we need enhance.
And Sherry, the mental health court that Montgomery County is going to begin is based on other models that have proven successful in the United States?
That's correct. Throughout the United States and specifically in Maryland, we have several jurisdictions in this state that we looked at. As Councilman KATZ said, we brought in judges from other jurisdictions. So Prince George's County has a very well-run mental health court, and Baltimore City and Harford County, and we had these judges come in and tell us what has worked for them, what didn't work for them. So we've seen how these courts work. The judges who will be presiding over the mental health courts have gone and they have visited those courts and sat in on those courts, as well as members of our legal community from my office, the state's attorney's office, the deputy state's attorney and state's attorney went and watched these courts, and defense attorneys. So it's been a hands-on looking and talking and really experiencing how these courts work. So this isn't a new thing that Montgomery County is doing. It is a well-tested type of court. So we really have a lot to look at to start with.
And because of the previous examples that Montgomery County can look to, Sherry, what do you think? How do you think this might impact the prison population currently, if we do have mental health court and a lot of the inmates who need mental health help are now funneled through mental health court? What is that going to do to the prison population?
Well, I think the prison population itself, the goal is that it will go down, in the sense of we're no longer using the prisons as sort of a holding facility, because that's not what they're designed for. They don't have all of the resources that the community can give, and so that is truly the hope. And recidivism goes down. So you have fewer people in the prison system anyway. It's not just those individuals who are getting the mental health care won't be there, but they are not reoffending as well. So the goal is obviously the rehabilitation as well as keeping down the recidivism.
And last question to you, SIDNEY, here. What does Montgomery County hope to achieve by establishing mental health court? What kind of example do you want to set for the rest of the country?
Well, first of all, Montgomery County has been a leader on many things for the rest of the country, and this hopefully will be another one. As I say, there's others that have already, as was mentioned, done the mental health courts in Maryland, but we hope that we can make certain that errors are done to be the most effective. And that's not to take away from what everyone else has already done. But to Sherry's point about the recidivism, I believe nationally that the rate for recidivism has gone down between 20 and 25%. We're hoping with their mental health providers, their nonprofit community, all of whom sat on this task force, that with their assistance and their abilities, that we can even have a greater a lesser people returning to the jail population, and there again help them become the citizens that they want to become, and be a great help to their families as well.
Well, very important work that both of you are doing. Thank you so much
Thank you.
for the work you're doing and for joining us. That's been a closer look at mental health in the county's prison population. I'm Crystal Park. Thank you for joining us.